Hey, everybody. Thank you for coming out to our Free Healthcare for All town hall. My name is M. Smith. I am a member of Workers Strike Back. I'm also a member of the National Coordinating Committee, which is elected by Workers Strike Back members, and I'm the campaign manager for Kshama Sawant's Independent Revolutionary Socialist Campaign for Congress. We have seen massive cuts to healthcare, massive attacks from both corporate parties. Just this year, we saw over $1 trillion cut by Trump and the Republicans from Medicaid and Medicare. We've seen ACA subsidies expire. Healthcare premiums are doubling or tripling for many workers. And the Democratic Party has failed to fight back. They failed to make the ACA subsidies permanent when they had power, when they had the White House and majorities in both houses of Congress. They failed to fight back against Trump's attacks. And right now, Washington state Democrats, including Democratic Governor Bob Ferguson, are once again pushing for billions of dollars of cuts to the Washington state budget, which inevitably will include attacks on our health care. We are here because we need a fighting strategy to stop these attacks on health care, and we need to go on the offensive to fight for free health care for all by taxing the rich. And we are here to build Kshama Sawant's Independent Revolutionary Socialist Campaign for Congress to lead that fight in Washington, D.C. We have to send a fighter to Washington, D.C. who will fight against the health insurance industry, against big business, against both the Democratic and Republican parties, which have been blocking the fight for universal health care. And that's what Kshama did for a decade on the city council, on the Seattle City Council, to win historic victories like the $15 an hour minimum wage, the first in any major city, which is going up to $21.30 in January. And everyone, as you walked in, applaud for $21.30. As you walked in, everyone received a list of other historic victories, renters' rights, healthcare victories, housing and workers' rights victories that Kshama won during her decade on the Seattle City Council. There's a long list of those victories. I can't go through all of them. And we're going to hear through Kshama in just a moment. I want to thank everyone also who's joining on the live stream. And we have watch parties today. We have a lot of people here in the room today. We also have watch parties in New York City, in Peoria, Illinois, in Ann Arbor, Michigan, in Rochester, Minnesota, and we have people watching from all over the country. So thank you for everyone joining on live stream. Thank you everyone for being here in person. We'll hear from Kshama in a moment. We have a few speakers first before Kshama, and then we'll get to our open public comment as well. First up, I want to introduce Bet Capehart. She is a longtime activist for universal health care in Washington state and a longtime supporter. Bet, give a round of applause. And for all speakers, just make sure to speak into the mic so that the live stream can hear you as well.
Well, I'm rather shocked. I didn't know I'd be the first person, but I get this over with. I'm always so nervous to speak. My name is Bet Capehart, and I've been involved in healthcare for all, single payer, Medicare for all, since 2009. And you'll all remember that that was sort of the start again of a discussion about the need for universal health care. And so then I was a board member of PNHP, which is Physicians for a National Health Program. For many years. I'm not anymore. And that's where I met Kshama. Kshama came, and we kept inviting her to our annual meetings. And I have a couple things to say about some of those meetings. So I met Kshama, and I have to say that I never witnessed anyone with Kshama's conviction, her energy, her brilliance, and her insistence on telling the truth and working tirelessly for working people and with them. And then I have a story to tell. So Kshama was at our annual meeting, and she was on a panel, and McDermott was there. Remember McDermott? Okay, he represented my district. My district is Congressional District 7. So he would come and blather about nothing. And So Shama, as she spoke, she said something about we need to really get this Medicare for All going. And when McDermott got up, he said, and to this young lady, meaning Shama, I want to say, you know it's going to take at least another 20 years. She's just telling you that. Shama waited her term. When she got to speak again, she said this, oh, we have to wait 20 years, but when Boeing wants something, you go into the room, and in 45 minutes, you deliver. And everyone sort of stood up and applauded and just cheered. Well, McDermott was furious and signaled his staff to come with him, and they stormed out. And I love that. So I just want to go real quickly through a couple of bills that have been presented by the Democrats and / independent Bernie Sanders. So John Conyers, the congressional person from Michigan, he presented probably the first single-payer Medicare for All plan under House Bill 676, and it was considered the gold standard for what single-payer could look like in this country. He, however, got very few people to sign on, and nothing. There was no movement. When Pramila Jayapal came into office, I think it was 2016, she took 676 and wrote it more extensively, and there it kind of laid. You probably have heard about that. And then in 2017, Bernie Sanders, the following year, came out with a Senate bill. And basically the lesson here is that all these bills, people will sign on to them saying they support them, but no Democrat has ever pushed it. It's never hit the floor of the the House. It'll go perhaps through a committee, and it'll die there. And they'll make all kinds of excuses, even when, as Em said, even when they had a majority of everything for 2 years. They did absolutely nothing. So we basically can't count on the politicians to deliver health care when they're paid off by the Medicare, medical industries, and big pharma. That's really the lesson here. And then a part of that, you probably all remember, it was a year after COVID started that there was a movement called Force the Vote. And basically it said the progressives should push Pelosi up against the wall, not agree to reappoint her as the leader unless this bill hit the floor for a vote so that people could expose themselves. That never happened. AOC said, Nancy Pelosi promised me a very important committee, and so I have to support her. And then Nancy Pelosi gave AOC nothing. So that's just what we can continue to expect if we think we can depend on these Democrat politicians. So now I just want to say a little bit about like the situation with our health care in this country, which you'll be hearing a lot from Kshama, and you have already. Our healthcare system is broken and breaking more by the day. Even something like Medicare, which was in 1965 created to help seniors. Even though it wasn't complete, it only covered 80%. They left a carve out for the industry, 20%. But even that has now been privatized up to the point of about 57 to 60%. 30 million people are uninsured. Over 50 million are underinsured. They have insurance, but it doesn't cover everything, or they get rejected. More than 500,000 people go bankrupt every year, and 80% of them have health care. 2/3 of Americans support universal health care, I mean, generally speaking, and it's probably increased, especially now. U.S. health outcomes. We have the highest costs for our health care, twice that of other industrialized countries. However, we have the lowest life expectancy and the highest infant mortality rate. And the disparities in communities of color are even worse than all of those statistics. So I want to quote an Irish Catholic priest. I think he was probably more of a liberation theologist who worked in Camden, New Jersey. He was from Ireland, very active. And one of the things he said about healthcare and capitalism, he said capitalism shouldn't be anywhere near healthcare. So thank you very much. I want to say healthcare for all. Okay. Everybody in, nobody out. Tax the rich. And free Palestine.
I'm going to say, what do we want? And you'll say free health care. And how will we pay for it? Tax the rich. What do we want?
Free healthcare.
How will we pay for it?
Tax the rich.
What do we want?
Free healthcare.
How will we pay for it?
Tax the rich.
Thank you, Bet, and thank you again, everybody who's joining on live stream. And we're going to be having a few more speakers before we get to our open public comment. And thank you again for everyone who came here and everyone who's come in since we started. Next up, I want to invite up Reverend Robert Jeffrey. He is the Reverend at New Hope Baptist Church in the Central District. He's a longtime activist for racial justice, workers' and renters' rights. He has been a longtime supporter of Kshama's election and re-election fights, including the fight against the racist right-wing recall against Kshama, which was funded by right-wing billionaire donors and real estate developers. Reverend Jeffrey was also a very active part and leader in the campaign to win the Amazon tax for affordable housing. And that included funding specifically for affordable housing for black families in the historically black Central District. And some of that affordable housing is now being built on the property of New Hope Baptist Church. So Reverend Jeffrey, come on up.
It's my pleasure to be here and to thank Kshama for all of her work. There is a $55 million complex going up on the grounds of New Hope, 2 buildings, all for low-income people. Thanks to you. Today in America, this country is spending over $300 million for a ballroom, $1 billion for a new jet for the president. They're giving $50,000 bonuses for ICE recruits to come into the communities and illegally arrest immigrants. They spend $1 million a day to occupy American cities. They spend $3.8 billion to Israel for weapons, for genocide, and $40 billion to bail out Argentina. But there is no money, they say, for health care. Today in this country, more than a quarter of the working age adults live in poverty, have no health insurance. It's estimated that 100 million Americans owe $220 billion in medical debt. Despite the Affordable Care Act, the percentage of Americans who can access affordable quality health care is constantly declining. Right now, it's below 50%. They also found that children who lacked health insurance are 60% more likely to die in hospitals than those who have insurance. There are two forms of genocide. One is intentional. One is intentional human. One is intentional, and the other. There are two forms of genocide. One is intentional, and the other is unintentional. Healthcare is as much a human right as the air that we breathe. Therefore, I've come here today to say, let us join with Kshama as she fights for the right of all men and women, boys and girls, to have health care in the richest country on the planet. This, I believe, is the new civil rights movement in America. This, I believe, is the new Birmingham and the new Montgomery. And we must engage as we did in Montgomery. We must engage as we did in Birmingham. As Dr. King put it, history will have to record that the greatest tragedy of this period of social transition was not the strident clamor of bad people, but the appalling silence of the good people. Injustice anywhere is a threat to justice everywhere. We're caught in an inescapable network of mutuality tied to a single garment of destiny. Whatever affects one directly affects all indirectly. He who passively accepts evil, and this is evil, for children to die without health care, for people to have no health care, no ability to go to a doctor of their choice, is as much involved in it as he who helps perpetrate it. He who accepts evil without protesting against it is really cooperating with it. Time has come to understand that the new frontier is to help people, to give them free health care. Now is the time to say enough is finally enough. We demand health care for everybody, every boy, every girl, every woman who walks the streets of America should have health care. We must demand it for all God's children. So I've come here today, I wrote down a few notes, just to let you know that I'm there. I'm there in Montgomery when they stopped the buses. I'm there in Birmingham when Bull Connor turned hoses on people who all they wanted was the freedom to access the accommodations in the city. I'm there with those children who sleep on the street, who want health care, those mothers who need prenatal care. I'm there. The fight has been joined. I join with Kshama. I join with all of those who wish to fight this good fight. Because when we fight, we win. We must unite ourselves now for this cause. This is the new civil rights. No justice, no peace. Thank you.
No justice! No justice! No justice! When we fight! When we fight! We have won over and over with Kshama's leadership in Seattle. I mentioned this paper that everyone would have gotten, hopefully, as you walked in the room. If not, you should pick one of these up. This talks about the endless, virtually endless list of victories that Kshama won during her decade on the city council, not by making deals with the Democratic Party behind closed doors, not by making deals with lobbyists, but by building movements of tens of thousands of people to win them. Historic victories, the $10 a month cap on late rent fees, 6 months notice of rent increases, caps on move-in fees, economic evictions assistance for renters who see their rents skyrocket year after year, where landlords are forced to pay if they raise your rent by 10% or more. The minimum wage, which is going up again to $21.30 in January. The Amazon tax for affordable housing. Victory after victory after victory that Kshama won by standing up and fighting back and mobilizing tens of thousands of people to win those victories, to pack City Hall, to go after big business unapologetically with bold demands. That is the kind of leader that we need in Washington, D.C. That's why we're here. That's why we're building this campaign to elect her as the first ever revolutionary socialist to U.S. Congress, to take that fighting approach that she took in Seattle and to bring that to Congress, to organize people nationally to fight for things. These demands that we're fighting for: free healthcare for all by taxing the rich, ending U.S. military aid to Israel, stopping the deportations, winning national rent control. And so I want to introduce the 10-year socialist on the Seattle City Council, the first socialist elected in 100 years to the Seattle City Council when she won in 2013, the leader of all of those victories year after year, a member of the National Coordinating Committee, elected member of the National Coordinating Committee of Workers Strike Back, and independent socialist candidate for Congress, Kshama Sawant.
Good afternoon, everyone. The U.S. healthcare system is a horror show, and working people are fed up. As Beth mentioned, 2 in 3 Americans want universal, publicly provided healthcare, with 90% support among Democratic Party voters. There's huge anger against billionaire and multimillionaire executives and shareholders of health insurance corporations and big pharma who are getting rich by denying people healthcare who desperately need it. Working people are ready to fight back. There's no question about that. The question is, what is the strategy? And as some of you have heard us say this before, we need a fighting strategy. What does that mean? So first of all, what do we want to win? Will be covered or not covered for working people. We want the free healthcare system to start building its own clinics and hospitals. We want the free public system to mandate living wage unionized jobs for all healthcare workers, not just doctors and engineers, but right down to the custodial workers. That is what we are fighting for. I don't want us to spend more time talking in detail about all the things that we want. A fighting strategy means understanding that making wish lists will not make the wishes come true. It means understanding the cold, hard truth that it will require almighty class war to win any of this, let alone all of it. Let's take a look at our enemies. Obviously, health insurance companies, pharmaceutical and medical device companies, for-profit hospitals. But these corporations are not inanimate objects. They are owned by billionaires and multimillionaires. And so let's keep in mind that the entire billionaire and multimillionaire class will fight us ruthlessly. And it's not only about the elite who directly have money in the stocks and shares of healthcare companies. The capitalist class as a whole is hostile to working people winning any victory, not let alone something substantial like this, because it sends an emboldening message to the working class that we can fight and win, as Reverend Jeffrey said. So what we end up actually winning will come down to the strength of our movement versus the strength of the powers that oppose us. So in other words, it will come down to the balance of forces between us and them. And don't believe anyone who peddles the lie that there is no us versus them. There absolutely fucking is. Capitalism is a zero-sum game. These health insurance profits come from denying people care. It is a life and death zero-sum game, and these people don't care about it at all. The divisions that we want to remove is the divisions among working class people, removing the us versus them between native-born and immigrant, between the nationalities, between genders, and so on. Those are the divisions that we need to eliminate. And because winning healthcare will require united and militant working class movements, so we need to unite. A fighting strategy means we need to understand who is on our side and who is not. Obviously, the billionaires and multimillionaires are not on our side. If we don't get that, I mean, we're in really deep trouble. I assume we all get that. Trump and the Republicans are not on our side either. They are openly hostile to workers, to the labor movement, to anything that working class people can win. But the Democratic Party is not on our side either, and that is where we need to spend most of our understanding to explain that this is what's going on. And again, there are confusions. Corporate Democrats like Chuck Schumer and Hakeem Jeffries, they are obviously corporate shills. Even people like Kamala Harris, less than a week after she launched her presidential campaign last year, for example, Kamala Harris declared publicly that she was not supporting universal health care, which had a lot to do with why she lost. My opponent, Adam Smith, is another obvious corporate shill. Adam Smith voted to cut Medicaid and Medicare by a whopping $150 billion in 1997 with Bill Clinton's so-called Balanced Budget Act. That was the bill that also opened the door to privatizing Medicare. A harder and less visible thing to understand is the role of progressive Democrats, labor leaders, leaders of the Democratic Socialists of America, liberal commentators, and NGO leaders. Let's look at what these people have done. In January 2021, Biden was in the White House. The Democrats had a majority in both the US House and the US Senate. This is, what we call a trifecta. And sections of the left, including me and my fellow revolutionary socialists, we led calls for AOC and the progressive Democrats in the US House to refuse to vote for corporate Democrat Nancy Pelosi as Speaker of the House unless she agreed to a debate and a floor vote on Medicare for All. This came to be known as the hashtag Force the Vote demand. AOC rejected this tactic, tweeting that, quote, the Dem votes aren't there yet. That was her tweet. And she suggested that force the vote would be short-sighted and use up political capital over what she called an empty threat without a strategy. She said instead, let's keep our powder dry. Let's save this strategy for winning $15 an hour because that's supposedly easier to win. And then she promptly proceeded to abandon the fight for $15 an hour also. The leadership of the Democratic Socialists of America at that time during Force the Vote joined AOC and the squad in rejecting it. And they said, there are no shortcuts to liberation. This is a quote from the DSA statement. This is completely dishonest because this is pretending that there was a better strategy. Let's just wait for that. But in reality, all of this was just an excuse to give cover to AOC and the progressive Democrats. Because the truth is that Nancy Pelosi needed the vote of the progressive Democrats to become Speaker of the House. The Force the Vote movement was demanding that the progressive Democrats use their numerical balance of votes. She needed their votes, their votes to extract at least the beginning of the launch of the fight for universal health care. That's what we were demanding. I publicly urged, for example, that AOC not just withhold her vote from Pelosi, but do that in tandem with calling for mass rallies and protest actions nationally to actually begin building the fight for healthcare. Every progressive Democrat refused to do a single thing for healthcare when they had the trifecta in DC. They even refused to demand that the ACA subsidies be made permanent. And now because of that, not only do we not have universal healthcare, ACA premiums are shooting up dramatically in January, and many people are just going to cancel their insurance because they can't afford it and be forced to play Russian roulette with their health outcomes. Not one labor leader helped the Force the Vote movement. Not one of the dozens and dozens of Democratic Socialists of America elected at the time. Now the DSA have nearly 300 people elected, but at that time, the dozens and dozens of them, well over 100 of them, not one of them did anything to help the Force the Vote movement. Most of these labor leaders and DSA leaders, they were totally MIA, missing in action. And the rest, as I mentioned, dishonestly pretended that they were just waiting for a better strategy. But all this talk about a better strategy is rubbish. There is no mystery about what strategy is needed, and it's not like there are 10 different strategies. The only strategy is the fighting strategy. And that involves breaking links with the Democratic Party as a whole and recognizing the primary role of progressive Democrats. Progressive Democrats are not, I repeat, they are not there to do progressive things and push the Democratic Party to the left and all of that. No, the Democrats and Republicans are both parties of billionaires. In fact, Democrats and Republicans are the most powerful parties of the global capitalist class. The purpose of progressive Democrats is not to try and win something for workers. Their purpose is to give cover to the capitalist agenda of the Democratic Party, and most importantly, to keep tens of millions of working people shackled to the two-party system in perpetuity. The role of Pramila Jayapal, AOC, and other progressive Democrats is to try and whitewash the crimes of the Democratic Party, which is now, keep in mind, not only a party of the billionaires in general, it is now the party of war and genocide. It's a party of deportations. Progressive Democrats have brought, Beth mentioned this, Medicare for All bills. They have brought those bills, you know how many times? At least 13 times. Maybe I've missed a few. 13 times. But not once have they built any momentum around it or brought it to a vote. Not once. Pramila Jayapal herself, on her own, has brought it 3 times, including this year. She brought a bill this year. But she has never built any momentum around it. She just announces it and then leaves it at that. This is what all these Democrats do. So on paper, she supports it. So she, people get to say, oh, well, you should vote for these Democrats because they support Medicare for all. And it's true that she and AOC and Bernie Sanders don't take money from health insurance and Big Pharma. As far as I know, Adam Smith does take money from health insurance. But not taking money from the billionaires is the lowest possible bar. If you don't even reach that bar, as my opponent Adam Smith doesn't, it's a cut and dried case for you to be thrown out of office by the working class. But this is the point. Not taking money from billionaires is not a guarantee of any kind, because all these progressive Democrats, including the Democratic Socialists of America members who are elected in the Democratic Party, all of them put together have won nothing substantial for the working class and have instead been in office allowing untold attacks on working and poor people. So in other words, on their watch, our lives have gotten progressively worse. They have allowed a genocide to happen. They are now refusing to take an anti-war position against war on Venezuela, merely saying that Trump needs congressional approval, as if congressional approval is any assurance of stopping the war when Congress is what voted to carry out a genocide. Going back to the Medicare for All bills, this year, Jayapal has done something even worse than usual. I mean, she's done this before as well, once before. But she allowed Adam Smith to formally join her as a sponsor of the Medicare for All bill. I mean, first of all, Jayapal has zero intention of fighting for it. She never did. She did not even push to make ACA subsidies permanent when the Democrats had a majority. But allowing someone like Adam Smith to formally support a Medicare for All bill is far more shameful. Adam Smith has spent 29 years as a general for the billionaires, and he's not about to suddenly turn into a working class fighter. The only reason he wanted to formally support this bill is because he is very afraid of our campaign and is rushing to try and clean up his record. He would never have signed on to the bill if it had any chance of progressing. That's why he receives massive campaign donations from health insurance. They have full confidence in him that he won't allow Medicare for All to go forward. So in other words, Jayapal is actively helping Adam Smith's attempt to whitewash his 29-year pro-billionaire record. And the example I'm about to give is not about healthcare, but it is clarifying. Just 3 days ago, for the second time in 3 years, Jayapal introduced a so-called Dignity for Detained Immigrants Act. If passed, it would end the use of private detention facilities and stop the inhumane and unjust treatment of immigrants. But it's not going to be passed. What's horrendous is that twice now, Jayapal has introduced this bill with Adam Smith. Adam Smith voted for George W. Bush's Homeland Security Act in 2002, the bill that first created ICE and the detention centers. And this year, and he has supported annual and ever-increasing funds for ICE and the detention centers. And this year, it's disgusting. This year, Jayapal even included Senator Cory Booker as part of her bill. I mean, Adam Smith and Cory Booker, I mean, these are absolutely horrendous warmongers, genocidal politicians. So I'm sharing these examples to reveal what actual function progressives like Pramila Jayapal serve as Democratic Party members. Their job, her job, is to make people feel, working people feel a little less angry at the Democrats and make them cling to hope that the Democrats will finally, maybe someday, one day, do something good for us. Similarly, the Democratic politicians in California have sold out working people. In California, they have a trifecta. They've had one for years. The governor is Democrat, and they have either a near supermajority or an actual supermajority in both houses of the state legislature, and yet twice they have crushed efforts for healthcare called CalCare there. All of this that I'm describing, this is a classic role of a gatekeeper. A fighting strategy means understanding that the gatekeepers are not on the side of the working class. Why do we call people like Jayapal and AOC and the California Democrats gatekeepers? Because on the surface, they appear like they should be on our side. They say they support progressive things, but in reality, their role is to put the brakes on any fight back by working people. Their peaceful careers and their six-figure salaries, all of that depend on keeping good relations with the establishment, with the billionaires, and they are part of that establishment, even though they may not be billionaires themselves. Being clear about the role of gatekeepers is a make or break for movements. Winning anything for the working class requires defeating the gatekeepers. And when movement leaders are not clear about this, movements reach a dead end. That is why the Black Lives Matter movement ended up winning so little despite being the largest street protest movement in US history. This is why fighting strategy means an independent movement, independent of the Democratic Party, of progressive Democrats, of DSA leaders, and the labor and NGO leaders who are also tied to the Democratic Party. A movement that has a leadership that understands that we need to defeat the gatekeepers in order to defeat the billionaires. There is no way to defeat the billionaires if we don't defeat the gatekeepers. And for us to do that, the next step about a fighting strategy is that we need breakthroughs. We can't just talk about it. We're not going to win free healthcare by having town halls as an end in themselves. This town hall is an action town hall. We want to take this town hall's energy and actually fight to win something. And for that, we need a breakthrough. Some might say, we should not get involved in elections. We hear this all the time. Some might say, well, I hear this from people. They say, I like you, but what can one Congress member do? So, there's confusion about whether we should even get involved in elections. And then even if we did, what can you do as a single individual? Some of you have already looked at this and mentioned this handout. This handout is proof positive that actually, if we have the right kind of leadership, that we can harness an elected position, one elected position, to completely change politics in the city or the nation. We won. As I mentioned, we have won an incredible victory. The minimum wage is going up from $9.19 an hour in January 2015 to $21.30 in January 2026. That is over 131% increase. I mean, it's insane. Have you ever heard of anything like this? And it's not only workers in Seattle, but because of Seattle's victory, tens of millions of workers nationally have won massive wage increases. Obviously, we would not have won that had my office, had I and my fellow revolutionary socialists, had we not taken on a fighting strategy. But first of all, even before that, we would not have won that minimum wage had we not won my city council election in the previous year. That was the breakthrough we needed. If we had not won that city council election, I am quite confident we would not have won the fight for $15 an hour, which now is an incredible victory. And so winning the election to the US Congress, winning the first ever revolutionary socialist elected to the US Congress, will be 1,000,000 times bigger breakthrough compared to the city council. Because we get to take, if we can win, we get to take the fighting strategy that we have proven so successful in Seattle to Washington, D.C. And when you take something to Washington, D.C., it means you go national. And so we will have a national platform for our politics. It will be nothing short of a political earthquake. How will we use our office? And I say we because we know that the threat to the ruling class is the combination of having the leadership of my congressional office combined with millions of people fighting back alongside me. And so I have pledged that if I am elected, I will turn my congressional inauguration into a mass rally of 10,000 people in Washington, D.C. to launch national campaigns to fight to permanently end all U.S. military aid to Israel and win free healthcare for all funded by taxing the rich. That would mean mass rallies, mass protest actions nationally to expose the Democratic Party. It would mean union members drawing strength from the fact that we would have won this historic victory to the US Congress and pushing the leadership or pushing the leadership aside, as the case may be, in order to carry out strike actions by labor unions. Alongside that, the plan is that we will use my congressional position to launch a ballot initiative for free public health care citywide in Seattle, paid for by a $5 billion expansion of the Amazon tax, a tax on the city's wealthiest businesses that we won. My fellow revolutionary socialists, Reverend Jeffrey, Uba Warsame, so many of them were part of that struggle that we won in 2020. A tax that is currently raising hundreds of millions of dollars every year for affordable housing in Seattle. Fighting to win our congressional election is absolutely central and super crucial for the fight to win free healthcare. A fundamental reason the fight for universal healthcare in California, there were several reasons, but quickly, a fundamental reason the fight for universal healthcare in California has resulted in multiple defeats despite having big unions supporting them, is because the nurses' union leadership, which led that fight, has completely refused and still refuses to challenge the Democratic Party politicians with strong, independent, working-class candidates. So it doesn't help that they keep bringing, the nurses' union leadership keeps bringing this bill forward. I believe that they genuinely want to win it, but they are not going to be able to win it as long as they are tied to the Democratic Party and refuse to challenge the Democratic Party and tell those rotten politicians that if you don't pass CalCare, we are going to throw you out by running strong independent candidates against you. That is the role of, that is the revolutionary use of election campaigns. And as far as the city ballot initiative are concerned, you will hear some people saying, oh, you can't win healthcare in one city, you should not get involved in this because we need a national movement. Of course we need a national movement. We want to win free healthcare for all, funded by taxing the rich for all people in the United States. We do need a national movement and we do need a national system, but we are not going to get that by sitting around talking about it and saying, oh, you can't do this and you can't do that and you can't do this, the other. We need a breakthrough. So winning our congressional election and winning free healthcare in a major US city like Seattle would be that earth-shattering breakthrough that we need. It would act as a battering ram in the fight for universal public healthcare nationally. It would really demonstrate what Workers' Strike Back says, when we fight, we can win, and it would decisively help to break the impasse that the Democrats, progressive Democrats hold. And to be clear, winning any of this, starting with our congressional election, as I said, going back to one of the first things I said, is going to be almighty class war. Not because we want it to be, but because it is. We didn't make this system. We don't run this system. Capitalism is a system of class war every single moment of our lives. And if we don't fight back, it is still class war, except that it's one-sided war from the billionaires against us.
That's right.
So our only options are either rolling over and dying in a one-sided class war, or making it a class war where we fight back and we defeat the ruling class. And but what does all this mean? It means that we have to get prepared. This is December. Everybody's going to go into holiday season. But come January, come prepared. Bring your game face or whatever they say, because we are up against the billionaires and we are up against the gatekeepers. And don't forget, the gatekeepers includes the progressive Democrats, most of the labor leaders and DSA leaders and NGO leaders. The billionaires are going to try and spend millions of dollars to try and stop us from getting elected. And after that, they're going to try and stop our ballot initiative. So we are up against enormously powerful forces, and we have no choice but to build a movement strong enough to withstand these attacks. And at the same time that we are fighting for these things, we are also fighting to end the genocide in Gaza, end all US military aid to Israel, and we are fighting against a Trump agenda who Trump himself has been elected again because of the betrayals by the Democratic Party. And we stand in solidarity with all those who are under direct attack by the Trump regime, including our Somali community members who are being called garbage by Trump. We would not have won many of our victories if it wasn't for Somali working people joining our struggle actively, and we're happy that we have a speaker, one of the speakers who led those struggles, will be speaking very soon. We need a complete overhaul of the healthcare system. We need free healthcare for all funded by taxing the rich, but we need to go further and get rid of the for-profit pharmaceutical corporations, medical device companies, hospital chains, and other corporations. Without the power to control costs, we would run into the limits of all these, the cuts and the supposed ideas of balanced budgets. So we need, raising our sights beyond what's immediately in front of us. We need to take the entire healthcare system and pharmaceutical system into democratic public ownership of workers. Because we cannot control what we do not own. Hospitals, clinics, suppliers, labs, pharmaceutical, medical device companies, all of these need to be run by the working class and run democratically in the interests of patients, healthcare workers, and society at large. We also need to understand the nature of capitalism itself. The reason private healthcare kills people is because this system is not a rational system based on human need. It is run by the billionaires in the interest of their short-term profits, no matter what the cost to the rest of us or to the planet. That is why our fight for good healthcare, for free healthcare, is intimately tied with a struggle against capitalism itself. So long as capitalism exists, its ruling class will try to undermine or take back everything that we win, which they have done even in the countries where they have won public, working people have won public healthcare. We need a fundamentally different society, a socialist society run by and for working people, not the billionaires. That is why I am a revolutionary socialist. I hope you will join us in the fight for free healthcare, to end the genocide and end all US military aid to the Israeli state, shut down ICE, and to win our congressional campaign and defeat Adam Smith and elect the first ever revolutionary socialist to the US Congress. Solidarity.
Keep giving it up for Kshama. We say no to war on Venezuela. We say no to any more U.S. military aid to Israel, no to the occupation, no to the genocide. We say fight the rich, not their wars. Fight the rich!
Not their wars!
Fight the rich!
Not their wars!
Fight the rich!
Not their wars!
We, next up, have Emily MacArthur coming up here to talk about how we can build this campaign, and then we're going to be getting to open public comment. But Emily is a longtime socialist and working class activist. She's played a leading role, been heavily involved in Kshama's campaigns going back years, in the fights for renters' rights, in the fight for the Amazon tax. She was the campaign manager for the Kshama Solidarity campaign against the right-wing recall, which we defeated. And so, Emily MacArthur, here you are. Give it up for Emily.
Yeah, it's an honor to be with all of you here today. As Em said, my name is Emily MacArthur. I work for Washington State Ferries. I'm a member of Workers Strike Back and Revolutionary Workers, and I'm proud to be a volunteer on Kshama's independent campaign for Congress. Healthcare CEOs and politicians in both parties who serve them are afraid. They see the financial cliff facing working people across the country, with nearly half of U.S. adults telling Gallup last month that they expect they won't be able to afford necessary health care next year. Republicans and Democrats on the payroll of the healthcare industry know that there's mass anger about how we are paying more only to get less care and get more sick. And they've played endless shell games, as we've heard from multiple speakers today, of committees, public health care exchanges, and all of these are just backdoors into private insurance companies' pockets. And we just heard from Kshama and everyone who's spoken here today in support of her campaign. No one is as good at cutting through the bullshit of business as usual politics as Kshama Sawant. The material victories that Kshama used her office to win here in Seattle are living proof that we don't need to settle. We can win big using the fighting class struggle approach that Kshama demonstrated during her decade in city council. Healthcare CEOs fear Kshama because she gets things done. We have a real shot to win this independent campaign and elect the first ever revolutionary socialist to U.S. Congress, but that will require thousands of people to get active in this campaign and thousands of people to donate. So in a minute, I'm going to call out some potential amounts that maybe you could donate. And as I'm talking, I want you to think about what would it mean to win this historic election. I know for myself, I'm thinking about sitting at the UW dental student clinic earlier this week and listening to all the elderly people around me talk about how it hurts to even touch their teeth and how awful that is and how no one deserves to feel that way, and that winning so that teeth don't have to be luxury bones for people would be a qualitative difference in all of our lives. And I want you to think what it will take to win that. And if you have a number in mind already that you're planning to donate, ask yourself if you can dig a little deeper to support this historic campaign. To donate successfully, you'll have to fill out every part of the finance envelope and return it to the volunteer who will come meet you when you raise your hand. Please write very clearly in all caps. We're legally required to collect all this information, and that includes a little checkbox that says, that you meet all the legal requirements. So just putting that out there. So hundreds of billions of dollars are being cut from the already meager funding for healthcare and essential services, both at the federal and state and local level. Republicans are certainly the field marshals for many of the most brutal cuts, but as we've heard, Democrats are carrying out brutal cuts in states they fully control, like this one. Just a few days ago, Democratic Party Governor Bob Ferguson announced a plan to cut billions from the state budget. And on top of that, vowed to veto any taxes on the rich. Kshama Sawant is singular in her track record of fighting against every cut to public service with her people's budget every single year she was in office. This approach defended programs for seniors, children, disabled people, and countless others. But she doesn't just successfully defend what we have. Kshama has boldly gone on the offensive and won victories that were thought to be impossible to win. Kshama used her public position to organize mass action conferences, pack City Hall, launch ballot initiatives, and fight every attempt by the Democratic Party and big business to undermine the movement. So I'm going to start high. The maximum amount of money you can give during this primary election is $3,500. Can people raise their hands if they've already maxed out to this campaign, just to show the strength of this movement? Thank you so much. Put your hands down. And if $3,500 sounds like a lot to give on the spot, you can also space that out monthly, right? We started this campaign early because we're fighting against a 25-year incumbent. So can anyone here donate the maximum $3,500 or start a monthly donation of $583 per month to max out over the next 6 months? incredible. Thank you so much. Volunteers will be around to collect these donations and help set up the monthly plan if that's what you want to do. We talked about this a little bit, but I know for many people, in fact, actually, this person who just donated $3,500, Bernie was sort of their entry point into radical politics. And 10 years ago, Bernie filled town halls across the country calling for Medicare for all. That momentum went on to elect Alexandria Ocasio-Cortez. But today, as we've heard, healthcare is more broken than ever. Unfortunately, Bernie and AOC have determined relational harm, i.e. their cozy friendships with the Democratic Party, are more important than upending the for-profit healthcare system that's immiserating working people. And that's why Kshama's campaign is independent. But it's also why it's unabashedly linked with building bold movements of militant working people and rejecting civility politics of the ruling class and rejecting bathroom deals with people like Nancy Pelosi. So who here can give $1,000 or more to send Kshama to Congress and break the blockade of gatekeepers? We had a supporter who was not able to be here today, and they originally, when they were going to be here, they were going to give $1,000, and then they said, okay, I can't be there, I'm going to give $2,000. So we've got half of that match. Can anybody give $1,000 to match that $2,000, even if you break it down over the next 6 months? Leave that to hang. It's a lot, it's a lot. I will keep it rolling. As Kshama explained, so-called progressive Pramila Jayapal is helping Adam Smith try and whitewash his bloody track record by allowing him to sign on to the Medicare for All bill, a bill that she never had any intention of fighting for in any case. And as Kshama said, Democrats have brought such a bill and then allowed it to die an invisible death 13 times. Free healthcare for all won't be won by politicians who are bankrolled by billionaires. Palantir CEO Alexander Karp was just bragging in the news about how his genocidal company that's already making money hand over fist over the genocide in Gaza, that they're looking to expand their presence of AI in the healthcare industry. They want to make money off of people being sick here as well. Karp has already maxed out his contribution to Adam Smith's campaign, as well as bankrolling a $1 million into a MAGA super PAC. While Adam Smith has Palantir, Microsoft, Elon Musk's SpaceX bankrolling him, we have teachers, engineers, baristas, nurses. Can anyone here give $500 today to help fight the billionaires candidate? Thank you, thank you. Woo woo! And that can include starting a donation of $83 a month over the next 6 months. That also counts, right, as this big contribution to this fighting campaign. And I know everyone here, I know for myself, I'm thinking, how many Christmas presents is that? You know, how is it? How do we pay December rent? So I think all of these sacrifices are just so admirable and incredible and show that we're collectively in this fight. Members of Congress have made the news for amassing huge sums of money, not just from their lavish salaries, but from the insider trading insights that they get from private congressional briefings and from having close ties to Wall Street in general. Tens of millions of people are disgusted and infuriated at both parties and hungry for leaders who don't sell out and who know how to defeat the billionaires. A CNN poll shows recently that 63% of people want a new party, not one led by billionaires. They want a workers' party. And one core principle of such a workers' party has to be that our elected representatives are paid no more than the average worker. Kshama was singular, not just on the city council, but across this entire country as a politician who for 10 years accepted only the average worker's wage, donating the rest as union strike funds and social movements. Taking home the average worker's wage is not a guarantee that you will not sell out, but it is part of how you show people that you're in this fight to win results for the working class, not build a career and a nice life for yourself. Who here can donate $100 in honor of Kshama making sacrifices for working people over the decade? That's incredible. And keep your hand up until a volunteer comes to talk to you, just so we make sure that we don't miss you before you step out. So I've named some big amounts. Actually, I'm going to give it a little bit of time, so keep your hand up if no one's spoken to you yet, just so everyone can make sure they get caught, because our volunteers, there's just a couple of them going around. But I've named some big amounts here today. But the reality is the vast majority of our campaign donations are much, much smaller. The median donation to this campaign is $25. Through thousands of working class donations, Kshama's past campaigns combined have raised millions. The last campaign that Em mentioned that I was the campaign manager for, that we attempted the right-wing recall that was trying to remove Kshama from office, raised over $1 million. And we'll have to do that again several times over to defeat Adam Smith. We already talked about how deep his bench is. So I have one final ask for people who haven't donated yet, who are here. Can you donate 50, 25, 15, $1 single dollar or any amount of money to help fund this campaign so we can show the billionaires that we have billions of people ready to fight them? We sure do. I can't wait to tell the total at the end of the public speaking, but I know that we raised some real dollars that are going to help get this campaign through the lean season, and I'm excited to be here with all of you. And I have one more ask. Kshama won historic victories because she was fully independent of the Democratic and Republican parties. That meant building our own organizations. I'm a member of Kshama's organization, Workers Strike Back. We voted overwhelmingly to support Kshama's campaign, and our members have been building it not only in Seattle, but around the country because it has national implications, right? Workers Strike Back members, who probably spoke to some as you were coming in today, have organized campaign tables in Olympia, Spokane, San Francisco, Los Angeles, Rochester, Minnesota, Peoria, Illinois, Ann Arbor, Michigan, Chapel Hill, North Carolina, Fort Lauderdale, Florida, literally all four corners, New York City, and the list goes on. And for those of you who have already maxed out to the campaign, is there any way that you could support Workers Strike Back today, right? Maybe you bought a paper on your way in, maybe you joined as a member, but if you've maxed out already, could anyone volunteer to donate to help build an independent campaign so we can fight these two parties of the billionaires? Raise your hand if you're able to, and a volunteer will approach you. But yeah, I'm excited to build this movement with all of you to elect Kshama Sawant to Congress. Thank you, and solidarity.
Thank you, Emily, and thanks everybody who's donated. Kshama's campaign, as of right now, has over 3,500 donors from all 50 states and Washington, D.C. and Puerto Rico. People nationally understand, and internationally understand what this would mean to elect Kshama Sawant to Congress, to build the kind of fight. I mean, to win something like free healthcare for all in the United States would be a massive victory for the working class internationally, not just in the U.S. We're seeing healthcare systems under attack all over the world, and we need to go on the offensive to fight back. We have another speaker, and then we'll get to public comment. I want to invite up Uba Warsame. She's a community leader and grassroots organizer involved in all sorts of struggles around immigrant rights, affordable housing, the minimum wage, education. She played a crucial role in the fight to defeat, which you'll see on your sheets here, the so-called Stepping Forward initiative, which was an attack on public housing by the Barack Obama administration, which we fought back against and won, which stopped a 400% rent increase for 4,600 renters in public housing. Uba also played a leading role alongside Kshama and her council office in organizing tenants at Rainier Court, which is a low-income housing complex just down the road here. We successfully, alongside tenants at Rainier Court, successfully stopped planned rent increases at that building and forced the landlord to make long-neglected repairs that, were just, terrible conditions that we forced repairs at that building. So Uba, come on up.
Hi, everyone. Good afternoon. I have 5 other things to be in one day, so excuse me if I am not in all the things I wanted to say, if I can't even say it, because there's so many things to do at this time in our country here and what is going on politically. Thank you, Kshama Sawant, for always being at the front, for always fighting the fight that nobody else wanted to fight. We've been in many places. Even I think we met unexpectedly in Minnesota when we were fighting for exactly. So we didn't even know that she's there. She didn't know I was there. But I heard that there was an event going on for the 15 minimum wage. Guess what? We found each other in that event. Not even planned. So I said, wherever trouble is going on, a good trouble, and that Kshama is in, I'm in. Because I like to start trouble. The good trouble. So as you have heard, the stepping forward, which we successfully defeated, and because we organized, and when we organize together, then we can win anything. So now, in the communities that it will affect, almost 500% of rent raise, and those were the immigrant communities, those were our low minimum wage workers who provide the most of the jobs that almost nobody want to take. But then they wanted them to not be able to afford having a home, roof over their head, where they can take care of their children. They have 2 jobs, those people, mind you. And some will argue, oh, no, they're not working. They have 2 jobs. Those are families that I get to know. Those are families that I was in their houses. But then yet, they wanted to raise the rent so they can be homeless. You know how much we're fighting homelessness here in Seattle. We're supposed to be one of the high-tech states that's supposed to be providing better jobs and more rates for the minimum, instead of the minimum wage. Now coming what? 21 and next year. If the $15 minimum wage didn't take place, do you think this would have been happening? I don't think so. So somebody has to start that fight when no one else can even think about. When everybody said that there's no way that the $15 minimum wage will go anywhere. Well, guess what? Not only did it go anywhere here in Seattle, it went to Minnesota, other states, and now we're talking more than 15. We're talking 20-something dollars because of the $15 minimum wage. So you have to be, there's a saying that says in Somali, you either are standing on the shoulders, or you either are standing next to a mountain, or you are the mountain. So we feel we can be the mountain when we fight together. So in this Congress race now, 25 years in office, are you kidding me? It's like a kingdom, right? Somebody has to say, well, this is not forever. You're supposed to be there. If you're not doing what you're supposed to do, move over. And if you don't, we will make you. That's what I feel. And for anyone to challenge somebody like that, I think many are saying, how? But then when I heard Kshama is doing that, I was like, that's what we're talking about. Yes, she can do that. And we all can do that. And we have to support her in order for her to do that. If we can take on $15 minimum wage and succeeded, if we can take on Seattle Housing Authority and win and overturn the stepping forward, I believe that what Kshama can do here, she can do over there in Washington. And we need her to be there. One thing I wanted to share with everybody is, we always say when candidates are running, they come to communities, they say their pitch, they say their words, they say what they are famous for, and then the minute they're elected, nobody sees them. You can go to their doors, they're not going to show up when you need them, but that I can attest to you. With Kshama Sawant, I was new person who moved to Seattle when I met her, and that was when the $15 minimum wage was, that fight was starting. 2014, I moved the end of 2013 here. And I met her. I was a newcomer. Nobody knew me in the city, even in my own community, in the Somali community. But then I was like, I heard what she was talking about. I heard what the campaign is about. And I said, okay, I know it's going to be a fight, but I like to join where good fights are happening. So I said, okay, I'm going to go ahead and do what I can do and organize the community. So imagine when no one knows you in the city. But then you want to start up that kind of fight when the community doesn't want any fights, okay? And I said, let's see what we can do. We're going to have to support her, and we're going to see where we can take this. Every community thing that was going on, every fight that community was in, everywhere we needed her, nobody stopped me to be at her door. Nobody stopped me to be at the city hall. Nobody gave me a hard time. So she has been making sure that we have access. So what she said and the promises that she made to the community has kept. So that is why I said she's different. She's different than all the other ones who disappear. And I talked to the community. I said, how many of them disappear? Oh, they can count till their fingers is no longer existing. More. And I said, now what do you see with Kshama? So she's available. She's supporting the community. When the taxi drivers and the Uber drivers were fighting, she was there. So basically anything that not only the Somali community, the East African community, other communities, all our migrants, when they needed her, she was there. And when we elect anybody to office, we want to make sure that they keep their promises, that they're going to make sure that they're there for the communities that elected them, not for the big making money, not for the rich, not for the millionaire. And you all know that that's not what she's for. She's the one who start fight with the millionaires, so we're like, let's go, right? So let's make sure that we join hand in hand. Let's make sure that we organize communities. Let's make sure that any little amount, when we were talking about, fundraising and donating, we need to make sure that many people who don't understand what $25 can do, that they know where it can go. Many of us at $25, that's how we make something big. So please donate. I will make sure that I'm always, of course, I'm with you. I will definitely be with you wherever we take this. And I am hoping that this is not going to be just the Kshama. There's going to be many other people like Kshama who will join and who will be elected to offices. Then we can overcome. And this thing that's going on with the Somali community and Trump, I will not even say the president, Trump, Donnie, that's what I've been calling. This man, I don't even know if I can say this man, but this person who not only will start a fight with the minority, with our East African community, with the Somalis specifically. And what he called us, I wouldn't even repeat, but we're nothing like what he say. The Somali community have contributed. They are part of what this country is. The immigrant community is what built this country. And if I might share a little bit of something, if he thinks he can intimidate the Somali community, no. What they did is they took this, they create memes, and the funniest meme that I've seen was this land in Minnesota they're talking about have been promised to us 3,000 years ago, and they created all kind of videos. You will laugh until you can't laugh anymore. So that means that this is not intimidating us. He can't intimidate us. His cahoon cannot intimidate us. We are here to stay, and we're not going anywhere. So I will say to every immigrant community, no one, including the man who's sitting in the White House, should intimidate our communities, should intimidate our immigrant communities. And we're going to fight back, and he is going to be out of that office. Hopefully he will not finish the 3 years that's coming up. Maybe we will get him out before that. But thank you, everyone. Let's continue with the fight. And maybe I have to say a few chants. When we fight, we win. When we fight, we win. When our communities are under attack, what do we say? Stand up, fight back. When our communities are under attack, what do we say? Stand up, fight back. Let's continue with the fight. Thank you, everyone.
Give it up for Uba. And let's do that again. When immigrants are under attack, what do we do? When workers are under attack, what do we do? When renters are under attack, what do we do? What do we do? What do we do? And we did stand up and fight back in Trump's first term, and some of you were involved in this struggle. When Trump's first Muslim ban went into effect, we fought back alongside millions of working class people around the country and occupied SeaTac Airport. Kshama led that fight, and we were one of the cities that completely shut down SeaTac Airport. Every flight coming in, going out, we shut down that airport and defeated that first Muslim ban. We need that kind of movement. We need someone in Congress who's gonna call for mass protests, mass strike action, mass civil disobedience, the things that are necessary to actually win and challenge power in this country. We now are going to move into public comment. Before we do, I just want to say a couple of things about further next steps that people can do to build this campaign. And that includes all those on live stream. And I want to reiterate, Emily gave an excellent donation appeal. Everyone in this room, donate whatever you can. If you're on live stream, donate whether it's $5 or $20 or $100, even $1. Whatever you can give to this fight, we need you to help build this. We are going to need thousands and thousands of people all over this country donating, volunteering, getting involved to build this fight to defeat Adam Smith and send Kshama to Congress. We also have, let me just get this paper. We have volunteer shifts coming up every day this week, or virtually every day this week. And so both for those in person and on live stream, we have phone banking happening every Saturday at 3 p.m. Pacific, 6 p.m. Eastern. If you're on the live stream, go to shamasawan.org, sign up for those phone banks, get involved there. But for those in person in Seattle or in the Seattle area, we have tabling and door knocking and postering going on all over the 9th District. We have actually tomorrow morning at 11 a.m., we're going to be out at the Geraldines just down the road here at 11 a.m. tomorrow in Columbia City. We're also going to be out at the Columbia City PCC at 5 p.m. on Wednesday, and we'll be there at 10 a.m. on Friday as well. We have a table at the Amazon Fresh in the Central District at 5 p.m. on Thursday. And we need as many people as possible to come out. This is how we talk to people. This is how we talk to renters, to working class people in the area who might not know who Kshama is, or might have heard about some of these victories, but haven't talked to someone about her campaign for U.S. Congress. We need to have those face-to-face conversations with people. Right now, we're collecting signatures on the ballot petition to get Kshama to appear officially on the ballot. We need 1,700 signatures. In just over a month, we've already collected over 1,000 signatures to get Kshama on the ballot. Like I said, we need 1,700. We want to blow that out of the water. We want over 5,000 signatures to get her on the ballot to show how much support there is for this campaign, and we're well on the way to that. Is there anyone who can come out to table over the next week in Columbia City or the Central District? Yeah, great. Be sure to sign up on one of these. And I think maybe there's some people with some of these. If you didn't get one at the tables up front, be sure to sign one of these, get them back to a volunteer. We also have on February 1st coming up, our next town hall. It's a rent control town hall in Kent. That's going to be at 2 p.m. on Sunday, February 1st. Who can come out to that on February 1st? I know it's a little ways out, but put it on your calendar. Great. We are going to be building for that the light rail stations, and I don't know, probably some people know this. There's new light rail stations that just opened up in Kent, Star Lake, Kent, Des Moines, Star Lake, and Federal Way. We were down there this morning, and in Federal Way, we raised over $700 at that Federal Way light rail opening to build Kshama's campaign. And that's regular working class people giving $20 at a time, $50, whatever they can. So we're going to be down at those light rail stations also this week, Kent, Des Moines, and Federal Way. Who can come out to one of those? Yeah, all right. Okay, we also have postering going on. That's happening on here. You can sign up for that. We have people who have been organizing house parties, getting 5 or 10 of their friends, family, coworkers together. Who's hosted a house party already for Kshama or is planning to? Great. Is there anyone else who can commit to hosting a house party or is interested? We should talk. Sign up on here. You can sign up for that as well. We're also asking people to talk to 5 friends and family over the holidays, tell them about the campaign, ask them to donate to the campaign, ask them to come out to volunteer, sign the ballot petition. Is there anyone that can commit to talking to a few friends and family over the Christmas break? Great. Be sure to sign up one of those 5 friends and family sheets, also at the tables in back. And finally, we just launched Socialists for Kshama. And Kshama mentioned the sellouts of the Democratic Party. People like AOC who ran as socialists but broke a railroad strike, but voted to fund the Iron Dome, part of the genocidal infrastructure of the Israeli state, have sold out working class people over and over and over again. We need a real socialist in office. We need a revolutionary socialist in office to fight for those things. So if you're a socialist, join Socialists for Kshama. If you're a member of the Democratic Socialists of America, we are going to be organizing to fight for an endorsement for a revolutionary socialist inside of that organization, inside of other socialist organizations. We need to bring the whole movement together to build this campaign. This is the most important campaign in the country. So sign up. You can go on the website. It's kshama.org/socialist-for-Kshama, and you can sign up there. So with that, we're going to move into our public comment period. Remember to fill these out. And those on the live stream, go to kshama.org, sign up to volunteer. So we have a couple people who have already signed up to get on to speak in public comment, and everyone should feel free to comment, to ask a question, and then Kshama is going to be coming back in at the end to answer some of those. Yes, and Joe up front has some time sheets. We're asking everyone to keep to under 3 minutes, and so he'll be flashing those as you go for 1 minute, 2 minutes, etc. And so if you can wrap up by 3, that will help us keep. We're already a little bit over, but help us keep the time. And Summer in back has a sign-up sheet. So if you know that you want to get on for the open comment period, can you raise your hand? See one here, one back there. So be sure to flag down Summer so that she can add your name to that sheet so we can make sure to add you to the list to speak. Okay, so we will go ahead and get started with Maddie, who is already signed up to speak. Maddie Danks? Great. We'll start it off with you. Give it up for Maddie.
Hi, everyone. My name's Maddie, and I work at a hospital here in Seattle. Over a third of the patients that my hospital serves are on Medicare or Medicaid, and somewhere around 5% are currently entirely uninsured. We serve the most precarious populations in the state, and every single day we see the horrible repercussions of a healthcare system that is so prohibits only a select and powerful few. These are people like Andrew Whitty, the CEO of United Healthcare Group, who made over $26 million last year, or Jim Retchin, the CEO of Humana, the healthcare insurance company facing a class action lawsuit for using AI to override doctors' orders and deny coverage claims, who's also a major donor to Adam Smith's campaign. Retchin took home a whopping $15.6 million salary last year. It is unconscionable that we live in the wealthiest country in the world and working and poor people are suffering and often dying at the hands of a for-profit healthcare industry. It is unconscionable that Trump is carrying out attacks on the healthcare of America's poorest and most vulnerable populations. And it is unconscionable, shameful, and disgusting that the Democratic Party hasn't fought back, has made no real attempts to fight for free healthcare for all, and instead have dangled universal healthcare to lure voters election after election with zero intention of actually fighting for it. We need free healthcare for all, and we need it to be paid out of the pockets of the disgusting billionaires who make billions, no trillions of dollars, robbing us for our health. We need to support Kshama's campaign for Congress and back the independent socialists who will fight tooth and nail against the two billionaire parties and fight for genuine working class demands like free healthcare for all paid for by taxing the rich. Electing Kshama is the game changer we need. Look at how the Democratic Socialists of America has elected more than 300 people into office, and all of them combined have not fought or have not had the political backbone that Kshama has, and have not delivered anything like even close to a fraction of what she delivered. We need fighters, and Kshama is a fighter. If you are a healthcare worker, I urge you to join this fight. It is the most important fight in the country right now. Thank you.
Thank you, Maddie. Up next, we have Josie and then Darren. Josie.
Hi, everyone. My name is Josie Ebelhair. I'm a social worker, and I'm a member of the Washington Federation of State Employees, which is the public sector union here in Washington. And I'm a member of Workers Strike Back. I'm extremely excited about this fight for free healthcare, and today we have heard and discussed a strong and concrete strategy to actually win it. Fighting to tax the rich in Seattle, in Washington, anywhere is a massive fight. We are going up against bosses with enormous resources to be used against us, and they have both parties of the billionaires on their side. Just this last year, during the Washington legislative session, Democratic Governor Bob Ferguson put forward a budget that would have cut $7 billion from the state budget, including furloughing state workers 1 day a month for the next 2 years. This budget would have slashed social services and public benefits and programs across the state. And this was a terrifying prospect for many state workers and Washingtonians, with state workers under threat for forced furloughs, meaning losing 1 month of our pay, and essential programs like long-term residential care programs under threat of being closed. With the leadership from Workers Strike Back and Kshama, myself and other WFC members brought forward resolutions in our union locals calling for a mass rally in Olympia. On April 9th of this year, hundreds of WFC members and community supporters marched on the state capitol chanting, "No cuts, no furloughs, tax the rich." We brought the House and Senate chambers to a halt as we marched inside the Capitol building, and from this rally, we were able to scare the crap out of the Democrats and reduce the cuts in the budget from $7 billion to $2.7 billion. This was a massive victory and shows that when we fight, we can win. It points to what is needed to stop these attacks on working people, but this fight should have been escalated further, with WFC and other public sector unions calling for strike action against these cuts. Unfortunately, the union leadership refused to do so. A fight to stop massive budget cuts or implement progressive taxes is a direct fight against the bosses and the ruling class. They are not going to give in to this easily. And that's why we need to build militant mass movements and rebuild a fighting labor movement. Again, Washington is facing a battle in this next legislative session as Democratic Governor Bob Ferguson is proposing a cuts-only budget yet again. Washington Democrats have a majority in the House and the Senate, but they will sell out working people like they did in the last session and are doing at the federal level. What is necessary to stop these attacks and austerity budgets from being put on the backs of working people is mass movements of working people, including labor unions, and for those unions to break with the Democratic Party, which does not stand with working people or our interests. Workers have lost again and again due to union leaders being tied to the Democratic Party, including horrific politicians like Adam Smith, who are bankrolled by big business and the pro-genocide lobby. The union leadership sees themselves as a mediator between the workers and the bosses, instead of leading workers into a fight for strong contracts and against budget cuts. Unions continue to endorse Democrats like Adam Smith and Bob Ferguson, who sell out working people year after year. Even though WFC passed a statewide ceasefire resolution, they have already donated the maximum amount to Smith's campaign, who has continued to vote to send military aid to Israel and block UN aid to Gaza. What is necessary is for labor to put their full support behind an independent class fighter who has shown again and again how she can take on the bosses and win historic victories. Kshama's campaign for Congress is the most important campaign in the country right now. Winning free public health care in Seattle will change and save lives. Working people deserve someone who won't just stand on the sidelines, but who will stand face to face against the billionaires and their two parties with a real fighting strategy to end military aid to Israel, free healthcare for all, affordable housing, and for what working people really need. And I encourage all labor union members to get active in this campaign, to donate to this campaign, to talk to your coworkers about this so that we can really fight for working people. Thank you.
I have Darren up next, and then Coco, and then Oscar. Darren, are you here? Great.
Hi, everyone. My name's Darren. I don't really have a comment. I just wanted to see if somebody could come up and explain the inner workings of the ballot initiative in Seattle. I can't wait to get my hands on a petition and start collecting signatures, and I'm curious about some of the details.
I have Coco up next. So Coco, Oscar, Danielle, and then Calvin. Coco? And then Oscar, if you can be ready to come up next.
Hello, my name is Coco. I am a new member of Workers Strike Back. I have come to a few of these meetings just with some horror stories that I think exemplify everything that's going on. With healthcare, last time I was at one of these meetings talked about how the state healthcare programs, unlike Kshama, who fought for the $15 an hour minimum wage, state healthcare programs do not adjust to the cost of living of our city, and so I have recently lost my healthcare. But on top of that, I'm also an office administrator at a health clinic, so my job requires me to break the news to a lot of people of what their insurance won't cover. And so I am faced with the frustration and disappointment from others that is the same frustration and disappointment that I've been feeling myself. I wanted to talk about a few of these cases that I feel like really summarize what that is like, and also kind of summarize the failings of not only the healthcare system, but also the violence of corporations that are often workers' only means of accessing any healthcare. So I've been in charge of paperwork for a few patients who work for some of my least favorite corporations, tech giants here in the city that I won't say only because of HIPAA. I'm going to try to keep this as, as nondescript as possible. Thank you. So these corporations have been treating their workers so badly that many patients are simply coming to our office just to report how severely they've been burnt out by these jobs so that the doctors can sign papers that say, yes, these patients are sufficiently miserable, please give them accommodations so they don't work themselves to death. But what's especially damning about this is that the insurance that these corporations provide these patients barely cover those appointments that allow them to get the doctor's notes, but don't cover any care that would help relieve their symptoms. Just like so many speakers here have said, the system is incredibly broken, and it is only people like the billionaire CEOs of these employers that benefit by treating their workers as completely disposable. I'm so glad that this campaign is promising to hold the Billionaire Party accountable, because it's clear and clearer every day that there is no other way. Thank you.
Thank you, Coco. Oscar is up next.
Hi, my name is Oscar. I'm a grocery worker and a rank and file member of United Food and Commercial Workers, UFCW, Local 3000. Grocery workers, like many workers, are struggling to keep up with the skyrocketing cost of living. I see my coworkers working full-time or working multiple jobs and still barely getting enough. A study from 2022 showed that nearly 15% of workers at grocery stores owned by Kroger were homeless at some point. Many are unable to make their rent or mortgage payments. On top of that, a shocking 25% said they went hungry at times in the last year due to not being able to afford groceries. Free healthcare for all, funded by taxing the rich, would be a massive help to grocery workers like me. Many union members, such as my fellow UFCW 3000 members and I, get health insurance coverage from our employer due to our union contract. But that also means every time our contract is up for negotiation, Kroger comes after our healthcare. in an attempt to increase premiums or cut back coverage. On top of that, the bosses always hold our healthcare as a leverage to intimidate us from demanding better wages. And unfortunately, the leadership of my union refuses to mount a real fight back and does not go on the offensive through strikes and mass protests to win both wages and healthcare. They prioritize their relationship with the bosses over fighting for the workers they are supposed to represent. When Kshama was on the Seattle City Council during the pandemic, Democrats came after grocery workers' $4 an hour hazard pay. It was so-called progressive Democrat City Council member Teresa Mosqueda who brought forward a bill to end the hazard pay. Kshama rightfully opposed her and the other Democrats who wanted to take away our hazard pay. Kshama was the only council member who fought to make the hazard pay permanent for all frontline workers. The UFCW 3000 leadership not only refused to join Kshama in the fight, but also publicly attacked Kshama and defended Teresa Mosqueda and her bill to end hazard pay. This is a stunning example of union leadership and the supposed progressive Democrats siding with the bosses over the very workers they are supposed to represent. It shows the importance of rebuilding a fighting labor movement based in class struggle, rank-and-file leadership and democracy, and the need for a new party for workers. Kshama has a track record of going up against the forces of big business and the political establishment to win unprecedented victories for working people. She does the important job of calling out progressive and labor misleaders who are betraying working people and leading them down the wrong path. Unions should be backing Kshama in this campaign because we need to build a movement strong enough to go up against the entire health insurance and pharmaceutical industries. That is why I will be petitioning my coworkers and my fellow members of UFCW to push for our union to support Kshama's campaign. I highly encourage all union members to do the same. Join me in petitioning your coworkers. Find those who want to join us in our fight and push resolutions within your unions to endorse and support Kshama's campaign. This is our best shot at bringing forward the fight for free healthcare for all and building independent working class power here in the United States. So I urge you to fight for your union support. Thank you.
Danielle, can you come up? And then John C., and then Calvin. Is there anyone who raised their hand who has not yet signed down with Summer? Okay. Great. Then I think we're going to close things off there. We'll get through the rest of the people who have signed up. Danielle, go ahead.
Hi, everyone. My name is Danielle, and I'm a member of Workers Strike Back. And I've worked in the health insurance industry for a few years now. It's not my career of choice. It just helps me barely pay the rent every month. And while working in the health insurance industry, I've worked in a variety of roles from customer service to product management, to engineering, all of the different things. And I witness firsthand every single day just how parasitic and purposefully convoluted the whole business of healthcare coverage really is. Because that is ultimately what it is. It's a business looking to make profit off of the health and wellness of everyday hardworking people. And one of the main ways they do that is denying people healthcare. It's absolutely horrendous how much time, work, money, and effort goes into just ripping people off and providing people with inadequate coverage, while the health insurance bosses make billions of dollars. Right now is open enrollment season, as a lot of us probably know, for insurance companies. So my main job right now is to just process new and renewing benefits for 2026. The majority of plans stay the same, except of course every year the price raises. So rates for health benefits will always go up. And you'd think with an increase in the cost that the quantity and the quality of that coverage would also increase. But in true capitalist fashion, it is the exact opposite. Health insurance rates will go up and the coverage provided becomes less and less. Maybe this year, Kaiser decides to remove RX pharmacy prescriptions from the medical plan that you used to have and makes it its own coverage. So now not only do you have to pay more for a medical plan that you used to have, but now you have to purchase two plans to get the same coverage that you had a year ago. And then from there, it gets even more ridiculous. I mean, there are millions of plans that I'm updating every day that have different qualifications. Like, it costs you more money if you're a former smoker, if you live in this area versus that area, if you retired in 2020 versus 2021. Like, it is endless, the ridiculous conditions that are used to nickel and dime people. And then even with insurance coverage, like many people have talked about, many people will still have to pay obscene out-of-pocket costs for healthcare services. It's a bankrupt system, and we are in a dire state of living right now. Millions of working people are going without healthcare that they need to survive. I used to work for part of the company that administered a benefit reimbursement plan for the National Firefighters Union. This was a benefit that firefighters would pay into every year, and then when they retired, they would have a pool of money they could get reimbursed. However, even with insurance provided by the union, there were dozens of restrictions and limits to what they could claim, and my job was to just answer their rightfully angry phone calls. I tried to help get people as much money as they could, but at the end of the day, I couldn't do more than my job allowed. And it just speaks to how messed up the system is, even that relatively well-paid union workers are still getting screwed over. And it goes to show that as long as health insurance remains for profit, even those with insurance will be screwed over. The responsibility to change this can't come from other working class people. It needs to come from where the exorbitant amounts of wealth are being hoarded. We need to tax big business, mega corporations, and the uber wealthy to fund free public health care. I need to wrap up. I'm probably not going to be able to finish. That's okay. Healthcare should be a basic right. We cannot rely on any politician, the so-called progressives who get in office on the false promise of fighting for Medicare for all, because we all know that they won't fight for us. This industry benefiting from this business are the wealthy execs and the politicians, while the whole process of healthcare for the rest of us is just miserable, daunting, costly, and really doesn't help us at all. And this is everyone's livelihoods that we're talking about, our friends, our families, our coworkers. And these politicians will only respond to mass pressure. I probably should wrap up, but all this to say, free healthcare is definitely possible. It's happened in other countries. Here in Seattle, it'll spread like wildfire, but we have to fight like hell for it. So yeah, I'll wrap up there. Thank you.
Great. And I was mistaken. It's not John C. These are two separate people. It's John and then Cole and then Calvin. John, are you here? No, John. John might have left us. Okay, Cole? Is Cole here? Oh, great. Give it up.
Hello, my name is Cole. I'm a Jewish communist and environmentalist, and I have a question for Kshama. With the Holocaust unfolding in Gaza, as well as the fascist terrorism in the United States and the Caribbean, climate action and environmental protections have taken an unfortunate backseat. As communists and socialists, we understand that the climate justice and decolonization are intrinsically linked. Therefore, neoliberal deregulation and capitalist exploitation should be confronted with uncompromising hostility. I am wondering how you, as a member of Congress, will address the intersection of climate justice, environmental protections, and decolonization.
Thank you, Cole. Next up is Calvin. Calvin, then Summer, then Justin, and then we'll go back to Kshama. Calvin?
So the essence of how this insurance system works is that it makes its profits off of denying people health care. The more health care they can deny, the more profits they make. And that's why United Health, the former Brian Thompson CEO of, the formerly Brian Thompson CEO company, denies 1/3 of its claims. So this is obviously a horrific system, and it is costing tens of thousands of lives every year. But the reason it's able to continue is because this system is a multi-billion-dollar industry that has the backing of both parties of big business. And so 1 million Pramila Jayapal press conferences are not going to change things, because the Democratic Party has shown throughout history that they are completely in bed with this industry, just like the Republicans are, and they are not going to do anything in favor of actually creating a public health care system, much less free health care for all, by taxing the rich. The only way this is going to happen is through an independent, militant mass movement, and that's what we're here talking about building. And so I think there are a lot of politicians who, show, over the course of their political history, what it is, all of these lessons about that we're talking about here in terms of the health insurance industry. One of them is Adam Smith, Kshama's opponent. So Adam Smith has gone, this way and that way over the course of his career, but overwhelmingly he's played a very loyal role for the health insurance industry. And so at the beginning of this, shortly after he was elected, he voted for $150 billion in cuts for Medicare. And this was actually carried out under President Bill Clinton. So the first massive attack on the Medicare system wasn't by Republicans, it was by Democrats. And Adam Smith and lots of other Democrats happily voted along with that. In the early 2010s, there was a resurgence of interest in Medicare for all, and that changed the way a lot of politicians were forced to talk about health care. But prior to that, there was a discussion of actually privatizing Medicare, and Adam Smith was among those politicians who spoke up in favor of seriously considering the privatizing of Medicare. In the 2010s, with this resurgent movement for Medicare for all, a lot of Democrats were suddenly forced to say things in favor of Medicare for all. And that's where we began, Pramila Jayapal became the master of ceremonies, having press conference after press conference. During most of this time, Adam Smith had nothing to say in favor of Medicare for all. But as the pressure kind of built, ultimately he realized, I do have to say something. And now, of course, with Kshama Sawant as his opponent, he's now signed on to Pramila Jayapal's bill. And Jayapal is only too happy to give him cover, because this is the way the Democratic Party defends itself. When there are mass movements for something like single-payer health care, when there are mass movements for rent control, when there are mass movements for something like a $15 minimum wage, the Democrats, they close ranks, and they make sure that they do what's necessary to stop that movement. And right now, what they want to do, what they need to do to stop this movement is they need to stop Kshama Sawant, and they know that. And so they're going to do what they need to do. The Democrats are going to give Adam Smith whatever kind of cover they need to give him to try to portray him as a progressive, which is really fucking hard to do. His full name, by the way, is Adam fucking Smith, which we were informed by a number of people in Federal Way today as they walked by our table. And so there's going to be an almighty effort to try to block this campaign. And the only way that we're going to make a breakthrough for free health care for all by taxing the rich, or any form of public health care, is for us to overcome all this opposition. And to overcome it, we have to be clear. This party, the Democratic Party, in no way, shape, or form represents working class people. It is, in fact, our enemy. The Republicans are also our enemy. I think a lot of people are clearer about that. But there is no country where universal public health care was won, and to be fair, all those systems are under attack continuously by the capitalists everywhere they've been won, but there's no country where it's been won without a massive, powerful movement of working class people that threatened either a new party or threatened revolution itself. And so that's what's necessary for us here, and this is just the beginning. And I think it's really important, this ballot initiative that we're talking about, because it is a way for us to make a breakthrough. We can't just stand and talk about this, year after year, that this is what's needed, this is how we're going to do it, or these are the details of the plan that we need. That's not going to get us there. We need to talk about an actual strategy to do it. And this healthcare initiative in Seattle could make that breakthrough. But in order for that to be real, we have to win this election. Because whether or not we can win this election has everything to do with how much momentum there would be behind legislation for free health care for all in Seattle or anywhere else. And we learned that lesson from the $15 minimum wage movement and the Amazon tax movement. Kshama getting elected in the first place is the only reason the $15 minimum wage was won. It's the only reason it was won here in Seattle, and the only reason it spread. And so for us right now, we don't need to know every last detail of this or that policy. What we need right now is a strategy to win, and that strategy begins with electing the first ever revolutionary socialist to office, Kshama Sawant.
Summer than Justin.
It's hard to follow. My name's Summer. I'm a member of Revolutionary Workers and Workers Strike Back. I agree with everything Calvin said. I think Kshama's campaign for Congress is the most important campaign in the country, as several people have said. Without Kshama's election to the city council, as Calvin just said, Seattle wouldn't have won the $15 minimum wage. Her office helped build a fighting movement that left the all-Democrat city council with two choices: pass 15 with yearly inflation adjustments, or face the consequences of the mass anger of tens of thousands of working people who Kshama organized as part of the 15 Now movement. As a result of Kshama's leadership, it jumped from $9.19 an hour in January 2015 to now $21.30 in January next year. That's an increase of over 131%. A victory that the political establishment literally called utopian until they were forced to pass it. That is exactly the kind of earth-shattering leadership that it's going to take to win free healthcare. And right now, only Workers Strike Back and Kshama's campaign are offering that strategy. In Canada, workers won healthcare because socialists fought for it in the Saskatchewan province, about the same size as Seattle. Workers won it because they organized independently of the two parties of big business, the liberals and the conservatives, and they built their own political party and elected their own representatives. And once they won, the entire country shifted. Momentum spread from province to province, expectations rose, and workers and socialists fought for Medicare across the country. The capitalist parties were terrified that the new working class party would get all the credit for winning universal health care and sweep them out of office nationally. The pressure on the political establishment became so powerful that a conservative federal government was forced to introduce Medicare nationally. The lesson that we need to draw from that is that when working people win a major breakthrough in one place, it can shift the national balance of power. Electing Kshama to Congress would be a massive political earthquake and open up a massive fight for free healthcare. She's putting forward a real strategy of a ballot initiative that would expand the Amazon tax by $5 billion to fund free healthcare for every single person in Seattle, including medical, dental, vision, hearing, abortion, and gender-affirming care. And a victory like that in Seattle or any major city would be a battering ram in the national fight for free healthcare. And electing Kshama to office, as Calvin already said, would be crucial for winning it and expanding the fight nationally. The $15 victory spread nationally because working people saw a successful class struggle movement led by socialists showing that we can win. Kshama Sawant is the only candidate providing the leadership and the fighting strategy needed to win free healthcare or any of these demands, like ending U.S. military aid to Israel. I'm a renter and a voter in District 9. I'm going to be voting for Kshama. I also donate $100 a month, which is a real sacrifice for me. I'm going to be going out as much as possible to volunteer to help build her campaign because I think we all need to do whatever it takes to defeat Adam Smith and send a real fighter to Washington, D.C.
Justin to close us out, and then Kshama.
Hey everyone, I'm Justin. I'm working on Kshama's campaign. One question that people might have is, what's the point of supporting someone running for Congress because don't all the politicians just sell out? And I think it's understandable for people to feel that way. I mean, we've talked a lot today about how even the progressive Democrats have been huge disappointments. Alexandria Ocasio-Cortez, AOC, was elected to Congress as a Democratic Socialist of America candidate back in 2018. Since then, she hasn't fought for anything. Kshama talked about how AOC and other progressive Democrats refused to even force the vote on Medicare for all, refused to even just start, the bare minimum steps of some kind of movement for this. AOC has gotten even friendlier and friendlier with the corporate, genocidal Democratic Party establishment since then, going as far as to call Nancy Pelosi, quote, Mama Bear. We cannot conclude from this, though, that elections are pointless. Unfortunately, the truth is that actually leaders have sold out working and poor people on every front. Elected officials in city councils and state legislatures, in Congress, in the White House, those are obvious examples for many of us. But there's elected leaders in the labor movement that have sided with all of those, other elected officials in government. There's non-elected leaders of liberal nonprofits and social movements, including in Black Lives Matter, that have prioritized their careers. The vast majority of the current leaders on the left and in the labor movement have decided to make an easy life for themselves by refusing to stick their necks out and lead a fight back. In contrast, Kshama has fought like when she led the 15 Now movement to victory, causing the Seattle minimum wage to increase from $9.19 back in January 2015, going up to $21.30 in January of next year. And just to put that in perspective, that's a 131% increase, which is 3 times the increase in the cost of living during the same period in Seattle. That's a major victory that spurred minimum wage increases all around the country. Tens of millions of workers won massive increases in the minimum wage, starting with Seattle. not because the labor leaders built a fight, unfortunately, but because Kshama used her first city council election in her office to build the movement, including rank-and-file union members. In fact, we would have not won had she not defied and defeated the labor leaders who were gatekeeping against the movement she was building. For an entire decade on the Seattle City Council, in the face of relentless attacks from the corporate media, from the Democratic Party council members, from almost every business and political organization in the city, in the face of all of those attacks, Kshama never sold us out. And despite all that opposition, she used her elected position to organize working people to defeat the billionaires and their political servants over and over again. Kshama will be an even stronger fighter for the working class if we can elect her to Congress, because she'll have a national platform to take that same fighting approach. Electing her is the breakthrough victory we need to win things like free healthcare for all funded by taxing the rich. Thanks, everyone.
Thank you, Justin, and thank you, everyone who spoke. Yeah, just another round of applause for everyone here and everyone on the live stream, everyone who's been here through this town hall and helped to build this campaign. We're going to close it out with Kshama, and I just want to remind everybody in person on the live stream, be sure to sign up on those volunteer forms, be sure to donate, get a shirt in back, start wearing that out, talking to people with that. And yard signs as well. We have yard signs. If you have a house, take one of those, put them in your yard. If you have an apartment, take one of those, put it in your window. We want to get those up everywhere. And so without further ado, back to Kshama.
I really appreciate everybody who spoke. And it's been a while. We've been here for over 2 hours, so I'll try to keep this as brief as possible. One question that came up was about climate justice and decolonization and how do we achieve all of that. Obviously, we all know, we know the information. We're not lacking in data. We know that time is running out, seriously running out, and we are facing the actual prospect of climate apocalypse. And so we do need a lightning fast transition to clean energy. We need free training and living wage union jobs for all the workers in the fossil fuel sector. We need massive expansion of free mass transit. All of this requires, at the bare minimum, taxing big business to make that happen. But honestly, the switch from fossil fuel to clean energy is not going to happen on the basis of the billionaires and the capitalists owning those industries. So addressing and arresting the climate apocalypse and taking the planet away from the precipice into something sustainable will require nothing short of socialist revolution internationally. That is the only way on which we will achieve climate justice and decolonization. Really, it requires international socialist revolution. And as a big step towards international socialist revolution, the international working class will need to take the major corporations into democratic public ownership. There is no way out. We can talk about the climate crisis and all of decolonization till the cows come home, but in reality, it is not going to change unless we actually build revolutionary movements to overthrow capitalism. And that is why we are revolutionary socialists, not because we think that it's enough to win free healthcare. It's going to be hard enough to win any of the things we're talking about on the basis of capitalism. And the irony is that to win any of such reforms under capitalism, it takes revolutionary socialists to do that. And the reason it takes revolutionary socialists to win something like free healthcare or the nation's highest minimum wage is because it is through our understanding of the way the capitalist system functions that we are able to fight against the capitalists. But we are not here only for that. We are here for the long haul to build international socialist movement, revolutionary movements in order to actually win socialism, which requires overthrowing the capitalist system, which means overthrowing the billionaire and multimillionaire class. And so, this campaign is very crucial in all of that effort. I don't agree with the people who do say, and I know they say because they're in the socialist movement, who claim that we should not be, working people should not be getting involved in this campaign because somehow it is at odds with winning revolutionary movements. Absolutely not. How on earth are we going to win revolutionary movements if the working class is not even organized enough to win free healthcare? It's a contradiction in terms. We have to reject these contradictions and understand that this campaign winning our congressional election, winning the first, electing the first revolutionary socialist to the U.S. Congress, first ever revolutionary socialist to the U.S. Congress, winning free healthcare for all, fighting to end the all U.S. military aid to the Israeli state. All of this is absolutely part and parcel of building revolutionary consciousness through winning victories so that we win more and more working people towards the revolutionary agenda. And as far as what our immediate tasks are, I really agree with Calvin that yes, we absolutely need the details of the ballot initiative, but not at this moment. As I said, we are fighting for the best possible things. We are fighting for free, high quality of healthcare that is available to everybody, regardless of what your needs are, regardless of what your citizenship or immigration status is, and all of that funded by taxing the rich. That is what we are fighting for, and that is what we want the ballot initiative to be as well. But I really, really urge everyone, let's not get bogged down in trying to think about the details of the ballot initiative, because all of that, I'm sorry to be blunt, but all of that is fucking pie in the sky if we don't win this election campaign. So we have to be very sober and very clear about what our immediate tasks are, that's building this election campaign. And our biggest obstacle in winning this election is not that the majority of the 9th congressional district in Washington state, let alone nationally, does not agree with us. We know the majority of people do agree with us. We have any number of opinion polls that tell us that. We have any number of conversations to prove that. We have our victories on the city council for a whole decade as proof that that's actually not true. However, we do face the obstacle that we are not the billionaire class, we are working people, and for the most part, what we face is working people not knowing about our campaign. So if you want to win that ballot initiative, then you have to help us win this election campaign. And if you want to help us win this election campaign, then you have to be out there canvassing with us, helping us talk to the hundreds of thousands of people who will support our campaign. It's just that they haven't heard about it. And part of why they don't hear about it is that the corporate media does not like to talk about our campaign. Why would they talk about it? They know that it is against their interest. It's not stupidity or incompetence why they don't talk about it. It is absolute a class, from the ruling class, it's a class understanding that our campaign is not in their interest to talk about. That is why we have to be out there talking to them, and it's not going to happen if a few of us do it. We all, every person sitting in this room has to come out and campaign with us, otherwise we're not going to win. And just a couple of other things. One is that in terms of why this campaign is the most important campaign, many speakers today have said nationally this is the most important campaign. So my message here is not only to the people in this room, the people in the 9th Congressional District, working people in Washington State, in our area. It is to everybody who is watching over live stream, everybody who ends up watching this afterwards, after tonight, if you watch it. This is a national campaign. So no matter where you live, you need to get involved if you want to win something for working people, if you want to change the direction of society. That means phone banking, hosting house parties. It doesn't matter where you live, you can host a house party. It doesn't matter where you live, you can help us with phone banking. But the primary responsibility, needless to say, is on the shoulders of those of us who are here on the ground. And so those of us who are fortunate enough to be here, at least at driving distance from the 9th Congressional District, we all need to be out there physically. We have to pound the pavement. We have to go out and canvass in person, because nothing is a substitute for an in-person conversation directly with somebody who will be convinced, because their life sucks too, and we can explain to them the reason their life sucks is because of capitalism, and they need to join us if they want to make their lives better. And so I have no doubt in my mind we will convince people, but we need people out there with us. And we don't say that this is the most important campaign nationally because somehow we are full of ourselves or we're arrogant or anything like that. As a matter of fact, it is a damn tragedy for the working class that we are the only ones fighting in the way we are fighting. It's actually far better for the working class if there were many more like us, but there aren't. So let's be, again, let's be very clear that is the reason why this is the most important campaign for people to get involved in if you want to see any kind of change. And then just lastly, if you want to see this campaign win, then you have to concretely help us out. You have to donate, you have to volunteer, you have to, if possible, decide to host a house party. But I will say, bottom line, you cannot leave here today without signing up to do at least one thing. Because if you don't, then we are not going to win. It's as simple as that. But if you start getting involved, and if you urge others to get involved, spend your holiday season talking to people, then we can actually win. And we see that Adam Smith is already very afraid. Let's make him more afraid as every month goes by, from January till primary election night in August. Let's make him very, very afraid, and let's eviscerate him and the Democratic Party. Solidarity.
Thank you, Kshama. Thank you, everyone who came out to this, an incredible town hall. Thank you, everyone who was watching on the live stream. I want to announce we raised today at this town hall over $11,000 for Kshama's campaign for Congress. I want to remind everybody, get out. We can build a powerful movement. We can send Kshama Sawant to U.S. Congress. Sign up to volunteer. Sign up to collect ballot signatures. Sign up if you're on the live stream. The phone banks are available on shamasawant.org on the 13th and the 20th, Saturday, 3 p.m. Pacific, 6 p.m. Eastern. Get out there with us and help build this campaign. And put on your calendar, February 1st in Kent at the Kent Memorial Park building. That is going to be the rent control town hall that will be live streamed for all of you on the live stream. You can tune in from wherever you are, and we want all of the people in this room to be down there in person with us. Solidarity, everybody.
I didn't realize how